you might get confused. On the outer side, because you have the AB duct, okay? You have the AB duct. You have to move your little finger away from the body, so it has to pull that, okay?
It's not in the thumb.
We're talking about the little finger.
But here you can see the...
Okay, everybody got it? Okay, that's the thumb. Look at the little finger. We're looking at the hyperthenar eminence, right?
They have the same...
Now, where we're looking at? We're looking at the hyperthenar eminence right now, the little finger, little finger. Okay, so AB ductor is located on the outside, okay? So this is the AB ductor digiti minimi, brevis, AB ductor digiti minimi. Beneath that is flexor, okay? Or, not beneath, like medial to it is flexor, medial to it. Beneath flexor is opponents. Everybody got that? Okay. And the other muscle, okay, did everybody show it to Rabia? Did they show it to you? Did they? Okay. All right, good. So how about then we have the palmaris brevis muscle. Where's palmaris brevis? Okay, we don't see it here, but, okay, so palmaris brevis, where is it located? It's under the skin, right? It's just based under the skin, basically attached to the skin, to superficial fascia. It does not have any connection with the bone. Okay, so it's most superficial. So the most superficial muscle in the hypothenar eminence. So if I ask you that question, the most superficial muscle in the hypothenar eminence is palmaris brevis muscle. All right, so that's that. Okay, let's finish up the muscle, then we'll go with the innervation, the nerve innervation. So that's the hypothenar eminence, okay? Let's look at the thenar eminence now, the thumb side. Again, thumb side, okay, this is again same thing. So we have the aviductor pollicis brevis on the lateral side. Beneath that is the flexor pollicis brevis. And then beneath that is the opponent. Same thing. It's just the mirror image of the little finger, the same position, same names, okay? One is digiti minimi and the other is pollicis. That's it, all right? So we got that out of the way, right? The thenar eminence. Okay, one other muscle that... Yeah, can you close the window? There's a lot of sound coming in. Okay, so the other muscle... Right, that's better. Yeah, the other muscle is adductor, right? Adductor pollicis brevis. Adductor pollicis brevis, which is located up here. So we have two heads of that. We have the transverse and the oblique head, okay? And it attaches to the side of the metacarpal, first metacarpal, and to the second and third metacarpal. So basically, it adducts, right? It moves the thumb towards the midline of adduction. All right. So that's that. That's the thenar eminence muscles. Now let's get to, so if you get this out, you can see the adductor pollicis brevis muscle. If you get this out in the hand, can you see this? It has two heads, transverse oblique head. You can see it, right? Okay, good. You get this. So if this is a deep muscle, okay. On the dorsal side, when you switch it back to the dorsal aspect. What you see here, we would see, so you see at the just next to the first index finger on the lateral side, between the thumb and index finger, we see a bulk, and we can feel it. You see this, so we can see a bulk of muscle. Okay, so part of it is it belongs to the first interosseous muscle, and also part of it belongs to the adductor pollicis muscle. So, and from the front, from the volar side, we can't see it, okay? Because why? We have a lot of muscles that that surrounds it. But from the back side, we can feel the first dorsal interosseous and also adductors slightly from the dorsal side. Okay, I'm going to show you that in the cadavra. So that's that. The other muscles that we have now, we have the lumbricals. Okay, the lumbricals. So these lumbricals, they originate from where?
Tendons.
Which tendon?
The tendon, the flexor digitorum superficialis.
Profundus.
Profundus.
Flexor
Superficialis.
Right, they originate from the flexor digitorum profundus tendon. So they don't have a bony attachment, they come from the tendon, okay? And they go laterally. Okay, they go laterally. Lateral, second finger, third finger, and fourth finger, okay? So the thumb side, let's say the medial side, the little finger side, lateral is the thumb side. So they go from the tendon laterally to the dorsal aspect or dorsal medial aspect of the proximal phalanx. Now what they do is they flex the metacarpal phalangeal, right? And they extend
The interphalangeal.
interphalangeal joints. Okay. So one of the things that you might misunderstand is that they go to the proximal phalanx, right? Attached. How can they extend that? The reason why they can extend the interphalangeal joint is that they go to dorsal digital expansion, right? And dorsal digital expansion, as you know, it starts from the base of the first metacarpal. It goes all the way to proximal and middle and distal phalanx on a dorsal aspect. This dorsal distal expansion with the lateral lip slip and the median slip. Okay, so so basically this lumbrical attaches to this dorsal distal expansion. So that's how it can affect the distal phalanx or middle and distal phalanx. And when they pull it, that's how they would extend the interphalangeal joints. Okay, everybody got that? All right. So lumbrical is important in claw hand and ape hand. Okay, and so if you have a deficiency in the ulnar nerve and median nerve, and that's how you would have, the sign of benediction in the claw hand. Why? Because you have this flexion of the metacarpal phalangeal joint and extension. So some of them can do it. The medial side of the lumbricals cannot, or the ulnar, if ulnar cannot, the ulnar side, the two lumbricals, the ulnar side, if they're damaged, so they can't do the metacarpal phalangeal flexion in the metacarpal phalangeal, and they can't do the interphalangeal, so they would have this, what we call this claw hand. So the function of the metacarpal lumbricals is important in order to understand the damage of the ulnar nerve and the median nerve. Okay, so lumbricals are important. Okay, so that's that. And the last we have what? We have the interosseous muscles. Okay. So we have the palmar interosseous and dorsal interosseous. Palmar interosseous would have 3 of them. Okay. And then dorsal interosseous, we have 4 of them. And like I said, on the dorsal interosseous muscle, we can see it from the dorsal side. Because the only thing that we have here is the skin and the tendons, the extensor tendons. And besides that, the muscle, the fleshy part that we see is dorsal interosseous muscle. There's 4 of them. Palmar, AD ducts. Okay, AD ducts. So it basically, so it pulls the fingers together. So it would go and attach to the medial side of the second. Okay, there's no attachment to the middle finger side. It would attach to the lateral side of the ring finger, and it would attach to the lateral side of the pinky finger. So if you go in and attach these muscles to the insertion point, they would have to do this adduction. Okay. So that's what is this? Which muscle? Does the palmar interosseous. Palmar interosseous. This adduction, dorsal. Okay. Dorsal interosseous. So palmar interosseous AD and dorsal interosseous is AB. Okay, dad, bad. Okay. So that's that.